Today's subject is on depression. Just remember, everything we do here is a summary and it's not intended to replace professional medical treatment and care.
Major depression, what most people think about is occurs in like about 10% of the population, so it's very common. Our antidepressants, third most prescribed medications that we do in our country at this time, and unfortunately a lot of those medications don't work as well as we'd all like to. And so when we look at how, as physicians, both in my pain practice and Jennifer and OB, we always look at depression as it's just a temporary event where the patient's had something occur in their lives that's causing them sadness or hopelessness, or on the other hand, it's something they've been dealing with for many, many years. And they're really, these individuals are a different category of patients, and it's not just the feeling of sadness and hopelessness, but that it also affects their eating habits or activity levels, their just ability to just enjoy life, basic things in life in general. And so when a physician is doing an interview with the patient, they're trying to rule out other things that the patients have experiencing in their lives and other conditions that they have that may be causing the depression. It's not just, they just woke up and they're depressed. There's other things that are happening as well. So yeah, premenstrual syndrome is one. Chronic pain, we see that a lot in our clinic. Some autoimmune disorders can do that. Low sugars, chronically low sugar can do that as well. So there's other things that can add to it. And you have to be able to weed through those and get the right reason for why the patients are having the depression.
So your doctor, if you're dealing with depression, has probably done a good job screening for different medical problems that can cause it. I think we have to get over a stigma,
Right.
and we have to
Right.
start talking about depression.
And don't be afraid of bringing it up to your healthcare provider as well. If you find that you're around people that don't understand what you're going through, find other friends. I mean, this is not something just to be ignored. It's not. It's not a character weakness. In both our practices, we have individuals who are highly functioning and very successful that are depressed, and does affect their disease or their symptoms. And I'm glad you brought up the issue of the stigma regarding depression. It's spiritual health is important, but you can't pray depression away. You can't impose on somebody to just keep praying that they're going to somehow get better. It just doesn't occur in some, and actually that's actually harmful to some people. Not to say that religion and spiritual growth isn't important in someone's life, but that alone will, and someone with major depressive disorder will not do the job.
It's okay if you're depressed and you love the Lord. You can have faith in the Lord and still have depression. It's okay.
Yes.
And once your doctor has done all the workup, make sure that you're physically safe, that you're not going to hurt yourself, then they'll probably put you on some kind of medications.
Yeah, and
This is major
some of them,
depressant
some will just
depression.
they'll interview the patient and say, okay, well, let's try something simple like exercise, or maybe change your diet, or put you on a medication. And one of the most common right now are the SSRIs. In addition, they'll probably introduce something called cognitive behavioral therapy. Let's say you've gotten a conventional medicine practitioner,
Right.
and they've done all those tests and they rule out, you do have some maybe metabolic issues that are being addressed, and they've started you on a medication, and you have gone to see a psychologist, and either you're having side effects to the medication or it just doesn't seem to be working, which unfortunately is more common than we think. You start looking at other alternatives, and this is what an integrative medicine can actually be beneficial, because you start looking at other areas in the patient's life. You start looking at environmental factors that can be contributing to the depression. There are some vitamin deficiencies, such as folate deficiencies, low vitamin D levels can also mimic depression or exacerbate depression. There's also some diets that actually, or a poor Western diet can actually contribute to depression.
Remember what they call, see, the diet that is healthy for us is a Mediterranean diet. We in the United States have what's called the Western diet, which is called SAD, Standard American Diet, which is also spelled sad because it's high energy food, highly processed, fried with refined sugars.
Yeah, and it's actually enhances inflammation in the body, and it leads to all sorts of chronic diseases. Depression, unfortunately, is one of those. So as an integrative physician, where we start looking at the patient medical history, and then we start focusing on things like their diet. And as Jennifer mentioned, the Mediterranean diet is one of those, and it's actually been adjusted here in the United States, and we call it now an anti-inflammatory diet, which actually took some of the anti-inflammatory dietary habits in Asian diets and put them together, and it's called an anti-inflammatory diet.
Omega-3 fish oil is really, really important, and you also want to eat like and that's safe for kids too. And they found improvement in depression with kids to add that with your medications. Like everything we're talking about, add it with your medications. But you want to eat small cold water fish like mackerel, sardine, and salmon. But you have to be careful that there's no heavy metal contamination with pesticides and mercury. So you cook with extra virgin olive oil, and you eat more vegetables than animals. And so I think that's pretty easy. More vegetables and fruits, less animals. Yeah. And so that's pretty easy to follow, and just limit alcohol and limit sugar. 2 to 5 cups of coffee a day is protective, but what's bad is refined sucrose, sucrose, and caffeine. So, and then daily tea is inversely related to depression. So drinking daily tea is good. 2 to 5 cups of coffee a day is good, but then refined sucrose and caffeine is not good. So just like anything in life, there's some good and some bad.
And then we can actually devote another segment to diet and anti-inflammatory diet. But other things that we look at as well as the patient's sleep patterns. You'd be surprised the number of people don't get adequate sleep, and these are not screened for correctly. And so once we address those, you'll find that a lot of the depression that people experience and decreased energy level does seem to be improved, as well as the patient's sleep patterns. And
that's a good one.
You'd be surprised the number of people don't get adequate sleep, and these are not screened for correctly. And so once we address those, you'll find that a lot of the depression that people experience and decreased energy level does seem to be improved.
The other thing is that with my pregnant patients and a lot of women is they feel that if they take sleeping aids, it's worse than taking Benadryl or Tylenol PM. And actually, Tylenol PM and Benadryl are both made up of diphenhydramine, which is Benadryl. Benadryl is diphenhydramine, and that's what's in Tylenol PM. My pregnant patients take it, they take Benadryl. That's fine short term. But if you've got insomnia and you take Benadryl, you'll have poor quality sleep, which means you'll sleep, but you're not rested, because what it does is it takes away your REM sleep, REM sleep. You won't dream. When you don't dream, you have depression. So dreams are wonderful to prevent depression.
Yeah. And even if you get to the point where you tried the sleep aids and those don't work, there's actually integrative approaches for that as well. Recommendations on what we call sleep hygiene in terms of how you approach your nighttime sleep periods, using some of the natural supplements such as melatonin and valerian root are also appropriate as well in these cases, because like Jennifer mentioned, some people take the sleep aids, and I've seen cases in my practice where they took the sleep aid and then discovered as time went on it didn't work quite as well, and they discovered they had a hangover effect at the end or in the mornings, and it actually interfered with some of the other medications they were taking. Other things that we also introduce to patients too is gut health, and we're going to have a whole section about that. Many times, because of our Western diets, we have what some people refer to as a poor gut microbiome. It's like the bad balance of bacteria in your gut. And so oftentimes we'll put patients on probiotics, and you've got to be selective on what type of probiotics that you're using. You shouldn't use the same type all
That's
the
right.
time. You really should switch to different types and different species of bacteria that are in the probiotic. But we'll devote a section in our vlog at a later date to that as well, because it's a
maybe
very
just
interesting
about
science.
probiotic. Yeah,
And
it's
gut
really
health,
cool.
gut health, and that seems to be a big topic right now. Vitamin D supplementation, and you really should ask your doctor first to check it, because there's no point in taking supplements if you're not low. In Missouri, I find that a lot of people have this because our weather's poor and people don't get out very much, and again, because of the poor Western diet we have. And I find this almost on the majority of the times that I am with my chronic pain patients that they are low in vitamin D. There's other herbs as well that can be used with depression, what they're called adaptogens that we've been trained to use, and one of the most common is ashwagandha. I know it sounds kind of a funny name.
When I first took my ashwagandha, Dr. Link gave me ashwagandha. And I go, Jackie, look at this. I got to take this ashwagandha. He goes, what, Queen Latifah? But they all have weird names. Rhodiola,
Yeah,
holy basil,
yeah.
ashwagandha.
So you're going to hear a lot of these, and you'll see these listed there. We'll
and they're
put up
not
on the blog.
expensive.
Yeah.
Exercise?
Yeah, and that's some other things that people need to understand as well. And it's very hard in the environment we're in too. We're having a terrible winter. It's really hard. It's really hard to get out and exercise, but that does play a big role. And there's a lot of good studies regarding aerobic and anaerobic exercise in terms of how it can help with depression. And you really don't have to do it a lot. It's really just 30 minutes at a time.
And it can be bits and parts.
Right.
Like taking the stairs for 5 minutes.
Yeah.
Walking the dog for
Anything
10
you
minutes.
can do.
All it just adds up to 30 minutes a day.
Yeah. Ideally, if you can, I'm a big fan of exercising outside. Jennifer sometimes always sees me outside the garage on Sunday mornings. I'm exercising.
And like you do, high energy exercise is more beneficial than low energy exercise for depression.
Yeah, and then one of the easiest things that can also be looked at too is yoga. There's a lot of yoga practitioners around. Almost where everybody lives, somebody's doing it. Make sure you get the correct type of practitioner, one who's used to. If you've never done yoga, make sure you tell them that you're a beginner. Otherwise, you're going to just be miserable and really hate the experience.
Our yoga teacher does hatha. See, there's different types of yoga, and Alexa Rapier, R-A-P-I-E-R, she does hatha yoga, and so that is actually proven to be good. Hatha and vinyasa are proven to be more effective types of yoga for depression.
Yeah.
That's good.
And other techniques that people have used with success, hypnosis is one. Breathing exercises whenever they're under a particularly stressful period. Acupuncture does have some evidence behind it, but it's not as strong as some other techniques.
Sounds good. So if you have ideas that you've learned because of your journey, share them in the comments below. Click to subscribe the button, and we appreciate it.